Now, 73% of residential clusters in rural areas nationwide do not have access to a health facility. That's according to the latest report published by the Ghana Statistical Service, which puts the spotlight on residential proximity to essential service facilities. Now, this means that if you live in a rural area in Ghana, you are most likely to lose your life when faced with a health emergency. Gushegu district in the northern region is the most underserved district in the country, with 54% of residents lacking access to health facilities. The report further reveals that half of all residential structures in the country live outside the recommended distance of 1 kilometer radius from pre-primary school. The Joy Research Desk breaks it down further and will bring you details in the following graphics here on Joy News Prime. And so, as you have it on your screen, we have the top 10 underserved districts, that is ranked by the Ghana Statistical Service. And so we are looking at, first of all, the proximity to primary education facilities. We have Setre Afam Plains District with 31.8%, the Central Gonja District, that's in the Savannah region, with 32.6%. You have the Pru West District with 32.8%. You have the Pru East with 33.9%. And then you have Gushegu, which just has a 19.8%. Kwewu Afram Plains in the eastern region has 20%. And these are districts with the least proximity to primary education facilities. So you have Bole there, you have Sine East, Banda District, the Sine West, and also Setre Afram Plains District. Let's now look at the top 10 most underserved districts when it comes to health facilities. So these are health districts that do not have proximity to health facilities across the country. And remember, there are 230 health facilities, districts across the country. So you have Karaga with 48.1%. You have Sine West with 49.4%. You have the Central Gonja District with 54.1%. Then you have Setre Afam Plains, 54%. Gushegu there, also very low with 40%. Gonja East, Mion District, Karachi District, Pru West again here when it comes to health facilities. Then Atebubu. And of course, we mentioned Karaga. So these are the 10 districts that are underserved when it comes to their proximity with, health facilities in the country. Now, let's go to the Bono East region and speak to correspondent Anas Sabit. Anas, 3 of the top 10 districts ranked as most underserved are in your region, with Pru East at the very top. You are on the ground. Paint the picture for us.
Yes, Ernest. The statistics as shown, or as you read earlier, is actually the true reflection of the situation on the ground. You look at these districts, precisely Pru East and Pru West districts of the Bono East region, you realize that a lot of the people in the Pru East area, are beyond the Yeji River, and as a result of that, getting access to the only health facility in the area is a huge challenge to these people. The entire Pru East and Pru West do not have any government health facility. The only health facility in the 2 districts is the Yeji St. Matthias Catholic Hospital, which is in Yeji. Now, this facility is serving both the Pru East and Pru West districts. And with the people of Pru East, who are mostly, especially those who are living beyond the Yeji River, they need to access either the Pantu or a boat to get to this hospital. And access to this hospital is a huge challenge for these people. And so I'm not surprised these 2 districts are part of the top 10 because of the absence of enough health facilities in the area. And the only one that is serving the entire area is not that closer to the people who are scattered across the area.
And you've brought us several reports on health in these districts and indeed in the region. Residents are indeed worried about it. What have they been saying, and what are health authorities doing about these concerns?
Yes, a number of times we visit this area. Some of the residents from our, the number of reports we've covered from this area, they are quite, they do not have hope now, as in the people getting the needed, health, care they deserve, especially in the Pro East area. Sometimes even health officials will have to cross to these communities with the boat, and so these people are currently without hope that there will be help from somewhere from our interactions with them. Until something urgent is done for these people, they have lost hope, as in the number of times we go there to even give reports. Sometimes they even tell you, we've been speaking about this for decades, nothing has been done, and nothing seems to be done about the situation.
No, East correspondent Anasa Bits there. Now, let's go on to the other Zoom link. Deputy Government Statistician in charge of Social and Population Statistics, Dr. Faustina Aidoo, joins us. Thank you very much, madam, for your time here on Joy News Prime. Now, this report is based on data generated from the 2021 Population Housing Census. First, underscore the importance of this report within the context of development.
Good evening, sir, and thank you for having me on your show. For the 2021 Population and Housing Census, we took delight in trying to capture all information about structures within the country. And for the first time, we took the GPS codes of every structure. And we also wanted to identify what these structures are being used for. So structures that were marked as residential and structures that were marked as maybe health facilities or other facilities. Now, one of the important things we wanted to know that for basic health or for well-being of people, we think that basic access to these essential services such as education, health, safety, and security is important. And therefore, we wanted to find how residential areas are either close or far away from these services. And the important thing is that if people have access to a basic education, they are able to make good use or educate themselves to be able to have a good livelihood. Again, for healthcare, as we talked about, a healthy people is a wealthy nation. And therefore, if the people are not able to access good healthcare, then it is imperative that something must be done. And so in this work, we try to find how far apart are residential structures away from these identified essential health services. And so we took this geo-reference, and therefore we wanted to just find out how residents are structured. And I made mention that for the residential structures, we know that in Ghana, some live in villages, towns, cities, hamlets, and therefore those that live in hamlets or villages, we try to put them in such a situation that we'll be able to have a group, because it is not prudent to just put a healthcare or maybe a school for a community with a population of only 50. And therefore, how do we get some of these groups coming together or nearby villages so that such facilities could be made available to them? And the importance is that development is hinged on making sure that everybody benefits from these resources that are available to us to be able to ensure that they live a worthy life.
So for those areas that are underserved, what may be accounting for this? Is it just poor planning, the lack of it, or even the lack of resources to simply provide these facilities?
Again, I think that we have to place this in context. For example, dealing with education, we did talk of that for education. Ghana Education Service sees basic education as having 2 years pre-primary, 6 years primary, the geo-reference codes of these structures. And for us, we took structures such as that have maybe served as a use as a bank, microfinance, savings and loans, and then we look at those credit unions. And therefore, we looked at areas have these structures there and wanted to know how far or close. For us, if you have maybe a banking facility or microfinance or rural bank or maybe a SUSU that is able to advance loans or people are able to deposit with them, it enhances people's businesses. And therefore, if in the rural areas it is lacking, then we believe that maybe in terms of accessing loans for development or credit, it becomes limited. And so this is the little I have to contribute. Thank you
very much. That's the Deputy Statistician, the Ghana Statistical Service, Dr. Faustina, joining us with details of a report they released today on the proximity of Ghanaians to key facilities, mainly health, education, and financial institutions. So we can look at some takeaways from the report that was released today. So it says 73% of residential clusters in rural areas nationwide do not have all the 3 required levels of basic education, that is pre-primary, primary, and junior high schools, and nearly 1/3 of rural residential clusters nationwide, that is 6% of urban clusters nationwide, do not have any facility providing education services. We could also look at some other aspects of the report, which says that 73% of rural residential clusters nationwide and 24% of urban areas nationwide do not have a facility providing health services. And over 9 out of every 10, that is 93% of rural residential clusters nationwide and 38% of urban areas do not have a facility providing financial service. And this is what we heard Dr. Faustina talk about and its effect. And there are substantial disparities in the availability of essential services between the urban and the rural areas. Again, half of residential structures, that is 51% of the country, live outside the recommendation distance, that is 1 kilometer radius from pre-primary school. Again, it says over half, that is 57% of residential structures are located more than 50 kilometers from a bank, compared with about 2/3, that is 66%, located more than 5 kilometers from a microfinance, and over three-quarters, that is 77%, located more than 5 kilometers from a savings or credit union. And it also says that the Savannah region has the largest percentage of residential structures living farthest from education and health services, ranking last for all 6 facilities providing these essential services analyzed. Let's do some more on this report. Chief Executive of Afriyie Education Watch, Afriyie Asari, joins us via Zoom. Mr. Asari, thank you for your time here on Join This Prime. We're learning tonight that half of residential structures in the country live outside the recommended distance of 1 kilometer radius from pre-primary schools. Is this worrying?
Yeah, good evening and good evening to your cherished audience. It is a worry to us. It's an issue we keep raising with government and stakeholders. Quite recently, I was in a community in the Western region, in the Memphis Central District, where Kofi Krum, to be precise, where girls had to walk 14 miles a day in and out to access junior high school. Why? Because about 25% of primary schools, I'm talking of about 4,000 primary schools, do not have junior high schools. So if you attend schools in this primary school and you complete school, you need to walk to the nearest community with a junior high school to continue your junior high school. And in the case of this community, they were doing 14 miles a day. If you go to Sine East, it is even there. I mean, the data you put out in the report suggests that in districts like Sine East, Ejurasitri, Dumase, Puru, in those regions, it's even there. 65% of primary schools in Sine East do not have access to a junior high school.
Yeah.
So in most communities, you graduate primary school into dropping out, or in private school where you have to pay. And if you can't pay, you drop out. That is why every day about 30 students in Ghana drop out of basic education. Okay. So the issues that have been raised by the statistical service are real issues that we education practitioners have been confronted with over time. And we keep drawing the attention of government to the fact that we have to increase investment in basic education. Now, underlying all this is funds. It is only money that you can use to provide adequate infrastructure, use to provide infrastructure at the right location to ensure that children are able to access pre-primary, primary, and junior high school education. But what are we seeing? In 2008, basic education by about 18 percentage points. The meaning is that we keep reducing investment in basic education outreach in our system.
So it boils down to investment and focusing primarily on basic education.
Exactly. It boils down to investment
challenges.
and ensuring that there is high standards of value for money and spending efficiency in the increased investment in basic education.
But you have seen what government has done with Get Fund, for instance, and all that they have talked about in terms of getting, some funds to support infrastructure across the country. We've seen it. Last year was a campaign year. We saw the many rounds, the many pictures that were shown across the country as far as education infrastructure is concerned.
Exactly.
Will this, and you have seen the plan, most of it, will this deal with it in the long run?
There are plans in place. I must admit that, yes, government has launched a program to eliminate 5,403 schools under trees, which means that there are 5,403 schools under trees. Now, this plan was launched, this particular plan was launched about 7 months ago.
Okay.
Government requires 3.5 billion Ghana cedis to provide these 5,463 schools under trees in the next 5 years. As we speak, only 2% of the money is available, which can build less than 16 schools. And so you don't call that prioritized funding. Now, Get Fund. What about Get Fund? As we speak now, because of the capping regime that the Ministry of Finance is running, only about 25% of Get Fund's inflow actually gets to Get Fund because of the capping regime. Now, apart from the capping regime, the Ministry of Education has securitized a portion of Get Fund for a loan. And that loan is heavily being used to develop secondary education infrastructure, which is great. So we can end the double track and expand access to secondary education. The challenge is that because of the securitization of the Get Fund and the loans that we are actually financing from Get Fund, this year, for instance, more than 60% or approximately 60% of Get Fund allocation went into servicing of debts.
Okay.
Not repayment, servicing of debt. So only 40% of the amount available after the capping, only 40% of the amount available went into scholarships, infrastructure, etc. So if you look at the funding Get Fund is providing for infrastructure development in basic education, it's a downward curve because so far as we have a capping regime where only about 25% of what should have come to Get Fund is actually coming to Get Fund, and the rest being diverted to other sectors of the economy, not education per se.
Okay.
And so far as we have Get Fund being used as a security for certain loans, you will continue to have very little available from Get Fund to build schools.
And so perhaps we need to look at a new financing model that will be able to deal with this. Mr. Asari, I'm grateful that you could join us here on Joy News Prime. That's the Executive Director of African Education Watch. Now, there's the health aspect of it, basically the access to health for many people in the district across the country. The medical sociologist, Dr. Gabriel Banaku, joins us on Zoom. He's also the former national chairman of Coalition of NGOs in Health. Mr. Banaku, the Ghana Statistical Service report talks about 73% of people in rural areas not being able to access healthcare facilities. Government has talked about Agenda 111, for instance. Is that plan enough to address this situation? Unfortunately, we lost Gabriel Banaku on Zoom, but that is, well, he's back with us on the line. Mr. Banaku, we lost you briefly, but I just want to know whether you think government's Agenda 111 will deal with this gap of 73% lack of access to health facilities for many in rural areas in the country.
Yeah, good evening to everybody in Ghana, and good evening to my chairman, national chairman, Brighton Mr. Nyako, and NGOs across the over 200 districts that the coalition is working. Yes, I would like to appreciate the report from what the GSS have done. It just adds value to what has been done. If you follow the trend of the coalition, over the last 2 years, we have always been on government to improve on access to healthcare service delivery, to improve on infrastructure, and also to work on the social health aspects in Ghana, which has been neglected. So the report has confirmed largely and scientifically that we were not just talking, but we were trying to draw government attention to be able to do that. So Agenda 111, very important. But before Agenda 111, our position has always been that there are still a number of facilities within this report from the Ghana Statistical Service that has not been upgraded, that could expand services to people around the vicinity. They have not been upgraded. We have polyclinics that need to be upgraded. We have district hospitals that are not befitting a district hospital state. We have communities that have cheap compound, they have built, but it's not commissioned, so they are not putting them into use. So government need to really clean up the health sector infrastructure provision before it can add on to others. So it's very clear in all the districts that the Ghana Statistical Service has brought the report, we have pointed to government facilities that are there that have not been completed, that have not been put to use, or that has been under utilized. So we cannot continue to make noise about it. It's very instructive. The research are showing, the reports are showing, and what government needs to do is to do a response to the people.
Very well.
But we, the Coalition of NGO in Health, we would like to say the following things. In Ghana, we do not have community medicine policy. At the national level, we seem to have recognition of the traditional medicine. But at the community level, which is part of constitutional provision, and is part of the Ministry of Health, Ghana Health Service arrangement, let's have a community medicine policy. So where health services are not reaching, the community health practitioners can provide access to basic support services. And when we say health, we are not talking about only medicine, but we are talking about psychotherapeutic intervention. We are talking about access to good nutritional services, which we already have, but we need a policy to back on that.
And so you think that once government adapts this measure, it will help bridge the gap?
Yeah, you expand, because
Dr. Banaku, I'm
the
grateful.
orthodox system is already doing, but we need to expand, and we need to find the other alternative to be able to expand access to health services.
Definitely. We'll leave it here because of time, but we're grateful that you could join us, Mr. Banaku. I'm grateful. That is the former director, chairman of the Coalition of NGOs in Health. He's also a medical sociologist.